na ile mashida ina kujanga through this. And let me tell you that you may not know, my specialty is gynecology. Gynecology. And by the way, if I may, gyne means a woman. Huh? Gyne means a woman. So sometimes we are told by our patients, who are mostly ladies, that this is my gyne. So what is she saying? This is my woman. But so this is my specialty. And how many people here are married, apart from the bishops? How many people are married? You see, most of you are young people. How many people want to get married? Majority don't want to get married. Why? May I know why you don't want to get married? Because getting married is obeying commandment of God. What did God say when He created Adam and Eve? He said what? Go and multiply and fill the earth. Have we filled the earth yet? Not yet. So that is why this topic is so important, because as you see, as we move on, you realize that there are so many people who have problems, and they come to us because sometimes they don't even understand their own bodies. So this is the normal reproductive system of female, and I will show you. That is the ovary, and that is the fallopian tube. It normally doesn't stay like that, the way it is drawn here. It stays closer to this place up here and here. That's the normal area where it stays. That is the uterine cavity, and that is the fallopian tube, the fibria. The fibria is like finger-like things that actually pick the egg or the ovum of a lady when she ovulates. This area here is called the internal os. That is where the cervix starts, and that's the cavity of the cervix. That is called endocervix, and this is the external os, and then down here that's the vagina. And I think I require somebody maybe to operate this thing. Like it's not oil. Yes, okay. So now that is a cross section of a lady. Now to be able to see the relationship between the uterus and other organs. Right here, that's the bladder. That is where urine comes, and you can see the relationship between the bladder and that is the ureter. The ureter is the tube that brings urine out, and that is right there. That's the vagina there, and this is the uterus. You can see the uterus is lying on what? On the bladder, isn't it? And behind it we have the rectum. That one. Majority of women uterus is like this. This is called anteversion. Anteverted meaning it is facing the front. It is facing the front here, in front of the bladder. But a few women, you will find that the uterus turns 180 degrees this way and faces the rectum, like this. It's called retroversion. Now the effect of that is that you will be able to get, you conceive, but you will have very painful sex. When you play sex with your husband, you experience pain. And maybe that is something that women don't know because they come to us and say they have this problem. And that's the reason why they experience pain, because the uterus is in that way, the route where the man goes, so it faces the back. The next one is going to be to work. The next one is going to show ovulatory cycle. Ovulatory cycle is this one. I'm showing how a lady gets her ovum. You start by, that's the follicle developing. Here it starts becoming bigger. This is bigger even, and it is this one, that one I'm pointing at, and then it is even bigger than the previous one. And at this stage, it comes out of the ovary. And you see, where like the shell of an egg, you leave something white here. This is called corpus luteum. And if you get pregnant, this is the area that is going to produce something we call progesterone, and the hormone that helps you to keep that pregnancy for the next 3 months. It is this thing here, corpus luteum, and that is when it is now old. So that's the process. Next one. Now, this is the male reproductive system. We have the bladder, we have the rectum also, and see now the urethra for males is much bigger. The male reproductive system, and you can see one of the things that you notice compared with the female one is that the urethra is very long, and this explains why women tend to have infections, what is called urinary tract infections. Every now and then they complain of pain when passing urine, and the reason is they are easily contaminated when either they are passing urine or they are doing their toilet activities. They can get infected, and they have that problem. Now, this is fertilization. Fertilization, the whole thing you are seeing purple is the egg or the ovum, and the small thing which looks like a snake is the sperm, and that's the size of the egg, or that's the sperm. You can see how big the egg is, and the sperm is so small, and that is why women will make only 1 egg per month, unless of course there are those who are predisposed to getting twins in their families, they can make 2 or even 3 eggs, and that's when you get twinning or multiple pregnancy, like triplets, quadruplets, like that. And the man, I was telling the ladies in the other side in Kikope, for a man to make a woman pregnant, he has to have at least 40 million sperms, and only one is going to enter here. They compete. Yeah? So men are supposed to be very healthy. For you to be able to make 40 million, one, you should not be a smoker. And I have heard the bishop saying, smoking is dangerous. It destroys your future sperms. Number 2, don't eat all chew muoka, the thing that is being sold. No muoka and the mirror, all those things, they destroy your sperms. Now, there are problems that come to women and they don't know exactly what is the problem. One, they experience very painful periods. If I ask the ladies who are here, how many experience pain during periods, they will say, they will put up their hands. That problem is called dysmenorrhea. That's all. Dysmenorrhea. And every time period comes, they experience a lot of pain. Those who are in school do not go to school. Those who are working, they waste a lot of time because they cannot go to work. In fact, since my office is right in town, CBD, in Afya Center, I normally have brought ladies who are being carried, side by people, because they cannot even walk. And they have brought me, all I need to do is to give her an injection of a painkiller, and she becomes okay, she starts walking again. Dysmenorrhea is a very, very painful thing, and we'll see the causes. Now, this dysmenorrhea, we are saying that that is the meaning, the definition, is painful menstruation. What are the causes? Caused by high levels of prostaglandins in the uterus. And the symptoms you experience is nausea, like vomiting, a feeling or having an urge to vomit. It is often called being sick to your stomach. And the treatment here is painkiller. We don't have acupuncture. There are very few people who use acupuncture, especially from the Eastern world. And then vomiting, herbs treatment. That is the treatment. Headache, you give painkillers. And then the irritability here means they also experience mood swings, mood changes, such that they don't want to see anybody, they can even abuse you. But it's not their problem. Actually, the problem is coming from here. Yeah. So when you get married and your wife starts having mood swings, know that it's probably because of that. You understand them the way they are. Now, number two, the other problem that we get, women get, is this one called vaginismus. Vaginismus is a condition where there is involuntary contraction of the vaginal muscles, such that they cannot have sex, they cannot have coitus. And sorry. Yes, so the cause of that is sometimes psychological, sometimes physical. And the reason why I included it here is because there is a young couple got married. They got married on Saturday, and on the same week, the next week, they were in my office. The husband complaining, oh, there is nothing they can do. This lady is saying she has a lot of pain, and we have to sit with them and advise them what to do, and sometimes examine also and see whether there is any difficulties. And surprisingly, after advising them what to do, now that lady, and they got married early this year. Now she's expecting. So of course they went through that problem. So women with this disorder are not able to have sexual intercourse without pain. And what do? Counseling and education. The other one is pain in the breasts, which normally comes around the period time. When the period is coming, they experience pain or breast tenderness. They feel the breasts are engorged. That is called mastalgia. Mastalgia. And the causes are that's the definition is period pain. It's most often associated with menstrual periods, as I have said. Then it is caused by hormonal causes, or sometimes trauma to the breast. And if the lady also have arthritis, they can also have this problem. The symptoms are pain in the breast area, ranging from minor discomfort to severe pain. And the treatment is given these NSAIDs are drugs that we give, like Brufen. Panadols also are in this group, and that may reduce the pain associated with mastalgia. So usually it's just painkillers that we give them. It's something that comes cyclically or periodically, and therefore is not something that is permanent. Another problem called endometriosis. Endometriosis is a disease that affects ladies, and what endometriosis means, as you saw in the earlier slide, that this area, the cavity of the uterus, is called endometrium, and that is where when you bleed, when you get period, you bleed from here, from inside here. So sometimes instead of, if this area, the cervix, is very closed, is extremely narrow, you get the period, instead of coming forward into the vagina here, it starts going back through the tubes and falls back into the cavity of where the intestines are. So that material is usually alive because they are cells, and they can start growing where they have gone, where they have been deposited. So when they start growing, every time a lady gets periods, that same area where those cells went is also getting periods, but they have no access outside. So it becomes like a swelling, and those swellings are the ones we call endometriosis. And we see what they cause in the next slide. You will find that the causes are there. Then that is the definition, the problem, and the symptoms are pelvic pain. There is usually severe menstrual cramping, either just or before or during periods. And in some cases, it can lead to infertility. It can lead to infertility. And then, of course, you can see there that immune system may allow the tissue to implant and develop into endometriosis. I've already mentioned that. And in some cases, when we look at cases of infertility, we find that between 30 and 50% of women who are unable to conceive, you can find that this is a problem. They also feel fatigue, tiredness, fatigue. This one here. And then bloatedness. Feeling bloated is when they feel like a lot of gas in the stomach or in the abdomen. The next one is what we call amenorrhea. Amenorrhea is periods not coming. When you come to us and say, I have not received my periods for the last 2 months, the first thing we need to find out is, are you pregnant? If not, then we go to other causes of that amenorrhea. Lack of periods is called amenorrhea. And it is in 2 types. There are 2 types. One is called primary amenorrhea. Primary amenorrhea is absence of menstrual period when a girl has reached 18 years and she had never menstruated. That's called primary amenorrhea. There could be reasons for that. One, deformity in the reproductive system. The one I showed you from the first slide. Either the uterus is missing or the outflow. There is a blockage somewhere in between the uterus and the outside. There is no connection, because we have cases like that where the vagina develops in 2 forms. One from up and from below, and they meet somewhere in between. Where they meet, there is usually a membrane that doesn't break. You understand now? So that you have a complete blockage. You cannot get access outside. But if you have been getting periods, or you have ever had periods, and then it stops, that is called secondary amenorrhea. This one here. When you have missed 3 or more times of the period. What are the causes? The causes are dramatic weight loss. For instance, ladies who are so conscious of weight, such that they are not eating properly. You find an adult female weighing less than 40 kilos. That is wrong. And those are the issues that you get into when you get so little weight. You start affecting other organs in the body. So dramatic weight loss, and particularly from drastic diets. You are dieting, you are not eating carbohydrates, proteins and vitamins. You are on veggies only, and then you lose so much weight. And eating disorders, including what I'm calling anorexia. Anorexia is feeling like you don't have appetite at all. You don't feel like eating anything. And then bulimia is the opposite of that. Bulimia nervosa is overeating, because it is not only when your weight is too low, even when your weight again is too high. You find a lady of 20 years weighing over 120 kilos because they are there. Okay? So dramatic weight gain, again, is a problem. Or morbid obesity. Or generally, what we are saying, malnourishment. You are not feeding properly, the normal way your body is supposed to be fed. The treatment for amenorrhea is congenital birth defects, that was, I've already mentioned that sometimes you find the development of the organs was not there, and that happens when the girl is in the womb of the mother. So you find congenital defects. Surgery may help. We may correct that through surgery, operating. If there is disconnection between outside and the uterus, we just need to open, and then we create that connection. Then pituitary tumor treatments, especially when you involve surgery or radiation, because pituitary is a gland that is in the brain, and that's where you get the hormone that is called follicle-stimulating hormone. It's the one that travels from the head to the ovary to cause the ovary now to start making the follicles. So if that channel is disturbed, then you find that you have a problem with this amenorrhea. Or when you start taking hormones irregularly. I find this quite common, especially in ladies who are taking a drug that they just buy in the chemist called P2. P2 is a progesterone hormone, and it is also called by lay people as morning after pill. So some of those things, they are the ones that are going to cause this problem of amenorrhea. Then the other one is menorrhagia. Menorrhagia is now a problem of having too much period. In other words, you are bleeding. The normal bleeding should be 3 days to 7 days, or 2 days to 7 days. If you bleed beyond 7 days, then you have a problem. You need to see a doctor, because the doctor will find out why you are bleeding that much. And sometimes ladies bleed to the extent of even having anemia. Anemia is when you have lost so much blood, your circulating blood in your system has become low or affected. What are the symptoms? Dragging pain in the lower abdomen, a lot of pain in the lower abdomen. And then menstruation becomes irregular. What are the possible causes? It's a hormonal disorder, like hypothyroidism is something that happens in the hypothalamus. In the thyroid, not thalamus, in the thyroid gland. It's not producing enough hormone. Then also using intrauterine device, that is the coil. It's a family planning method we call coil, and it can also cause a little bit heavy bleeding. And the treatment here depends on what is the cause. When we identify the cause and treat it, then you are okay. The other problem that we also have with women is what we call pelvic inflammatory disease. Pelvic inflammatory disease. Pelvis is where you have the fallopian tubes, the ovary, the uterus. The bladder is also there. And when that whole area gets infected, because sometimes it gets infected, you have a lot of problems. Not only that particular time, because you go to the doctor and they will treat you, but it has some subsequent problems. For instance, infertility. You'll find that people who have this issue when they are young, they are the people who get married, they stay several months or several years without having children, and when they come to us, we investigate and find that the fallopian tubes, which I showed you at the beginning, have become blocked. Why they become blocked? Because of this PID. So it is so important But just as the bishop was saying, and I listened to him advising people, and he's very good. He's like a doctor. You remain, if as a young girl, you don't want to get this PID, remain chaste. Chastity. That means don't sleep around with young boys or even men. Just stay the way God made you. Pray for her husband. Her husband will come. You get married, and you have children without a problem. The problem is when you listen to your peers, and they start telling you that since you haven't experienced that, because you have not slept with anybody, you are still a virgin. They don't know that you, who is a virgin, you are the gem, the gold standard is that one. Yeah, amen? And men the same. And some of these issues come because of sleeping with multiple friends. And I normally tell women, because I advise when they come to my office, that, you may be faithful to your husband. But if your husband is not faithful to you, he has 3 other ladies out there. I'm a 4, I'm a 5. It's like you sleeping with the same 5 men out there. So it doesn't really make a difference. Men and women are supposed to be faithful completely, so that you avoid such things. And you can see that the result is sexually transmitted infections is what causes PID. Symptoms are pain in the pelvic region. Sometimes you experience fever, abnormal vaginal discharge, which tends to be smelly, heavy or prolonged periods. Periods become very heavy, and then pain during sexual intercourse. So those are the symptoms you experience when you have PID. And again, the causes are when people are young and sexually active. That's when they get this problem. And usually sexually transmitted infection treatment is antibiotics, of course. And sometimes the doctors may do this. Laparoscopy is a procedure we do. It's a surgical procedure to investigate inside the abdominal cavity. Then antibiotics plus painkillers may help. Now this one is for ladies who are much older. Atrophic vaginitis is when it's a problem that comes because estrogen, which is supposed to help ladies have secretions within the vaginal lumen, they have a problem of dryness. And you find that the symptoms are vaginal dryness, vaginal itching and burning, vaginal pain, problems with sexual intimacy because of painful intercourse. This is for ladies who have reached menopause, or for some reason if they undergo surgery and ovaries are removed, that is when they get this problem of atrophic vaginitis. The causes I've said is what I've indicated there. After menopause, when the ovaries stop making estrogen, the walls of the vagina become thin and vaginal secretions are lessened, so that it's very easy for them to get injury. And the treatment is oral estrogen. In other words, replacing what they are missing in their bodies. Because they are missing estrogen, if you give them estrogen, then they become okay. Then estrogen containing vaginal creams or vaginal suppositories. Those are drugs they insert inside, and they help. in relieving this problem. This is now, I've left women a little bit. We may come back to it. Now I'm on men. So men, what problems do men get? One of them is diseases of the prostate. Yeah, there is one here called benign prostatic hypertrophy. Hypertrophy just means it has enlarged. And you saw where the prostate was during the first slide, or we'll see again ahead. You see benign prostatic hypertrophy. You find nodules. This is like small swelling. They are the ones called nodules. Hyperplasia or hypertrophy form in the inner prostate. And then the urethra, because the urethra passes through it, is compressed, leading to obstruction to the flow of urine. So the problem you get is that there is difficulty initiating ejaculation. You cannot start urine easily. And the reason why you find this happening as people become older, you'll find young boys and young men who are maybe in the teens, if they had a lot of urine in the bladder, if they lie down in bed like here, they can actually hit the syringe with urine. If they open, it can hit what? The syringe. But as people become older, you'll find if they initially they were reaching, the stream could reach there, they start coming here, then down here, like that. And eventually, this dribbling is urine coming in drops, not even in a stream. It is just coming in drops. And that is what's called dribbling. And then you get incomplete emptying of the bladder, leading to frequency. That means one goes to the toilet, after a few minutes you feel like urine is come back, you go back to the toilet. That frequency of going to the toilet becomes high. In other words, when you're a man, if you're married, starts visiting the toilet 3-4 times a day, in a night, there is trouble somewhere. And this man should be checked whether he has this prostatic hypertrophy. Then, because of urine is not coming out completely, you get infection. That means you can also have your kidneys affected because the urine starts going backwards. That is, instead of flowing out, it starts finding its way up to the kidneys. Then you get bladder distension. This is enlargement of the this thing called ureter. That's what is called hydronephrosis, and then kidney is damaged because of that. So it can lead to many other things, and that is why men are supposed to be checked their prostate. And how do we check? We check through ultrasound or just a finger called DRE, that is digital rectal exam. And most men refuse to go to be examined because of that. That he goes and the doctor tells him, remove your pants, and they want to fix a finger on the rear part. They fear. They don't want that. So, but one should not fear. Common in older men, that is prostatic hypertrophy, varies from mild to severe. Change is actually Hyperplasia of prostate. Hyperplasia, I said, is just enlargement. Nodules as like pimple-like swellings around the urethra, a result of imbalance between estrogen and progesterone and testosterone, and it has nothing to do with prostate cancer. Prostate cancer is something different. This is just enlargement of the prostate. Once it's treated, you are okay. This is what I was saying, rectal exam. The doctor just puts a finger and he feels that the prostate is enlarged. Then continued obstruction leads to dilated bladder and blood-directed ureters, and the kidneys may be damaged, of course leading to renal failure eventually. So surgery may be done or may be required because of that. What are the signs and symptoms of this problem? It causes partial or sometimes partial complete obstruction of the urethra. The urethra is completely enclosed within the prostate. It becomes that the urine cannot flow anymore. It leads to symptoms of urinary hesitancy, frequency urination, dysuria meaning painful urination, and increased risk of urinary tract infections and urinary retention. How do we know that you have prostatic hypertrophy? Through blood tests or through the digital exam I mentioned, or through ultrasound. So those are the ways. You go to visit a doctor, they take a bit of your blood and they will examine this thing called elevated prostatic, it's called antigen, prostate specific antigen, PSA. You have seen that? You have, for men, that is something that you need to be investigated fairly frequently. PSA means prostate specific antigen, and if they are elevated, it means that your prostate is enlarging. So that is the normal prostate. You can see this is the bladder there, and this is the urethra coming through the prostate here. So that's the normal prostate. But when you look at this one and compare with that, you can see this is a bit enlarged, isn't it? And when it is enlarged, it's now closing in on the urethra. Okay? So that is benign prostatic hypertrophy. But now, when you look at this other one, this is now prostate cancer. It has already become cancerous. Okay? And it is something that is one of the cancers that kill men a lot. And sometimes because either they are not aware that they are supposed to be examined or they just ignore. Your bodies are just like cars that we use. Yeah? After some time, you need to take your car for service. Even though the car has no problem, you are driving it well, and you have not experienced any problem, you take it to the service to replace things that have been worn out. So our bodies are the same. We need to take your body for service, and the service is the doctor, just normal. In fact, women are much better than men in this field. Extremely good, because I've seen a number of ladies, and they come and tell me, Dr. Mimi, I just want a normal checkup. I have no problem. They have no problem. They just want a normal checkup. And it's very hard to see a man come into the office and saying, I want a normal checkup. And that's where we fail as men. What are the signs of BPH, this benign prostatic hypertrophy? You have obstruction to urine flow, hesitancy or dribbling, and decreased force of the stream, incomplete empty bladder, and frequency of obturation. Treatment is what I've given there. If it is it's not too big, you can just be given drugs like what I'm calling here Flomax, and that it will open the urine flow. And then there is surgery, which is not very invasive, which can even be done under local anesthesia, called transurethral resection. Transurethral resection, that means the doctor is going through the urethra upwards and cuts the prostate that is blocking, such that he opens. That's the procedure, transurethral resection of the prostate. You can read there, as the name indicates, it's performed by visualizing the prostate through the urethra and removing tissue by electrocautery or chap dissection. This is considered the most effective treatment, and it can be done under spinal anesthesia or even general anesthesia. And the outcome is good because 80 to 90% of the cases you find that the person improves. The next one is prostate cancer. Prostate cancer, you can see the prostate there. This is the bladder and this is the urethra coming through all this way, and the enclosed in it is the prostate. Now the green part there is the one that has started having cancer. This is it. The other problem that men come with is what we call erectile dysfunction. Erectile dysfunction. This is where a man has trouble getting or keeping an erection. And it's normally called ED, short for this, erectile dysfunction. And it becomes common as one gets older. But male sexual function is not a natural part of aging. So some people have trouble, talking about this issue. Because sometimes when men have this problem, they almost come to us secretly. They are so down because their wives have really pushed them in the home. That go and see the doctor, go and see the doctor, and sometimes they are even brought by the wives, almost being held by the hand. And when they come, you'll find that the issue is this one. They are not able to keep an erection or be able to perform. And one of the issues here we get is damaged blood vessels, or the blood vessels are clogged with something. In other words, the blood vessels that supply the testes have been affected, especially by diabetes. This is one of the biggest problems we have, diabetes mellitus. So for people who have history of diabetes in their families, maybe their parents were diabetic, mother, father, or siblings, older siblings, it's important for you to be checked. And it's a very simple test. You go to a lab and you say you just want something we call random blood sugar. And you'll be able to see you have diabetes or not. If you have diabetes, you start getting symptoms of thirst. You're feeling thirsty all the time. You are feeling like going to the loo all the time, peeing so many times, you could be having diabetes. So you need to visit a doctor and you are treated early so that that problem goes. So erectile dysfunction is also called impotence, occurs when a man can no longer get or keep an erection firm enough for sexual intercourse. Having erection trouble from time to time isn't necessarily a cause of concern. But if erectile dysfunction is an ongoing problem, it may cause stress, and a relationship between the couple becomes affected. And then the man loses this, which is very important for a man. Self-confidence goes down. Self-esteem goes down. In fact, sometimes when men come with this problem, if you listen to them very carefully, they are almost suicidal. No? Because ameona kama ako useless. And there is nothing as important as a man feeling he's important in the family. So if he feels useless, then he becomes suicidal. In fact, they come and tell us, hey, me, I'm finished. You have to really build them up again to have their self-esteem good to a certain level. So it's very, very important. And the symptoms may include trouble getting an erection, trouble keeping an erection, or reduced sexual desire. Causes, you'll find that sometimes physical, sometimes it may also caused by heart disease or clogged blood vessels, hypertension or high cholesterol, high blood sugar pressure, diabetes, obesity. Obesity again being overweight. One person, you become overweight, then you have problems. Metabolic syndrome, a condition involving increased blood pressure, high insulin levels, body fat around the waist. And then Parkinson's disease. This is the disease where people walk like they are not stable. Parkinson's and multiple sclerosis. Those are issues that can cause that problem. So, and it's also caused by low testosterone. Testosterone is a hormone, male hormone, that makes a man. It makes a man have facial hair, and this is another disease, Peyronie's disease, development of a scar tissue inside the penis. Certain prescription medications. You see what I said, tobacco use, smoking. You can see it's there causing this problem. Alcoholism and other forms of substance abuse, whether it is cannabis, whether it is these other drugs, heroin and all, they all cause this problem. And then treatment for prostate cancer or enlargement. The case that, what I've already discussed, if a man goes through that treatment, they may also have this problem of erectile dysfunction or ED. Then surgeries or injuries that affect the pelvic area or spinal cord. If you have a spinal cord problem, then you will have a problem of ED. Then there is psychological causes of erectile dysfunction, because brain is the one that connects all these issues. And if a man feels unhappy or has some financial problems, they have this problem. Because for a man to feel happy and well in everything, everything has to be okay for them. They cannot even desire to have sex until they have settled. All right, so brain plays a big role. Depression, anxiety of various issues, be it financial, be it children misbehaving or children running into trouble in school, all those things, and other mental health conditions. Even stress, stress, when you go through, you are employed, but your boss is really stressing you, giving you unmanageable deadlines. You have to finish this job by this time. So you take that stress back home, then you can't relate with your wife. Relationship problems due to stress, poor communication, or other concerns. So those are the issues that bring that ED. Complications resulting from erectile dysfunction may include an unsatisfactory sex life, stress or anxiety, embarrassment or low self-esteem. Self-esteem again has come. Marital relationship problems, and then inability to get your partner pregnant. You want a baby, but or the wife wants a baby, but you cannot get because of this problem. It's a big problem. Tests and diagnosis. Tests include physical exam. The person goes to the doctor for physical exam, checking the penis, testicles, checking for nerves, for feelings. And then blood tests are done, may be sent to be checked, heart disease, diabetes, low testosterone levels, all these urine tests for likelihood of infection, diabetes, and all these conditions. And then ultrasound can also be done, showing how your system is, and then overnight erection tests. So those are things that can be done with the advice of the doctor, so that one can be helped. A psychological exam, the doctor may ask you questions to screen for depression and any other possible psychological causes of erectile dysfunction. How do we treat it? Oral medication, we give oral medications for that. Treatment, they include the Viagra that so many people know about. Ranitidine is a fairly new drug. It's called Cialis, and this one also, Reproduction. Those are drugs that people use, but they are given on prescription. These are not drugs we just go because you want to feel macho. You go and buy to go and surprise your wife. No, these are given by prescription. These are the cases you have had. I don't know whether you have heard of something they call blue pill. I think it's one of these. And it's the one that you may scare somebody, even politicians. Someone just died in bed because of these things. So it's not easy. Don't just go and buy. The other one is injections that can be given by a doctor for, like this one called Cavaject, into the base and side of your penis to make it strong. All these are tests, treatments that can be done. And then the replacement, finally, replacement of hormones. Some men have erectile dysfunction because of low levels of hormone, so you can be given extra hormone. Then there is that one called penis pumps, penis implants, and blood vessel surgery. So those are the issues that I felt are important for young people to know, so that when you get married and you find yourself with this problem, know that there is hope. Because some people, like I said, feel like they are finished. Since they cannot do this thing, they are finished. They feel suicidal. Don't commit suicide because of this. There is treatment. Okay? And I beg to stop there at the moment. I invite questions. Maybe we have questions.